Welcome to our Virtual Health Clinical Series. In this video, we will be demonstrating how to engage your patient in a virtual exam from vital signs to an appropriate abdominal exam. As Sir William Ulcer said, listen to your patient, he is telling you the diagnosis. There is a lot of information that can be gained by looking through the camera at someone and using your power of observation to its fullest. Engage your patient up front and let them know they will be participating in the exam today.
I'd like to do part of an examination to try to figure out what's going on.
Okay.
I'm going to guide you on how you can help me determine if this abdominal pain and diarrhea is anything to worry about. Looking at you look very normal, but I think we can add to that a little bit.
Okay.
Okay.
The great majority of examination is possible through video with a little creative thinking. Patients can follow your instructions to aid in their own examination. Not only does this add valuable information to the physical examination, the patient becomes an active part of their own healthcare. In this scenario here, we see the patient engaging and taking their own vital signs. We can ask them to do their own blood pressure reading or temperature taking prior to or even during our visit. Initial impression will help us identify our level of concern for the patient's clinical condition. Take note of the patient's appearance, their emotional state or speech patterns. Are they flush or diaphragmatic? Are they relaxed and speaking in full sentences? Having the patient help by checking their skin turgor to assess for dehydration or the whiteness of their eyes to aid in your diagnosis are two great ways to enhance your abdominal examination.
Lean forward a little bit. It's a little easier with the camera. All right, perfect. That's nice and white. And let's go to the other side. And that's nice and white also. Great. Good. Go ahead and back up a little bit. I'm going to ask you to push back a little bit in your chair and tilt the camera down a little bit so I can see your belly. And I'm going to ask you to point, where is it hurting? Can you actually guide me where it's hurting?
So kind of just like right in the middle.
Okay. All right. And have you noticed, I think you might have said you might have a little bit extra rumbling. Have you noticed that at all?
Today, yes, I have.
All right. So I'm going to ask you to do something a little silly, but I'm going to have you back up a little bit. And I'm going to ask you to jump up and down 3 times.
Okay.
1, 2, 3. And have you noticed that did the pain get worse when you did that?
No.
Okay, perfect. That just kind of tests if there's any irritation on the lining of the abdomen. And I believe you told me you were using a laptop. Is that correct?
Yes.
You may need to ensure that the patient has the ability to move freely during their exam. Whether using a phone, tablet, or computer, the ability to move the camera throughout the visit allows inspection of different areas and body mechanics.
Do you feel comfortable doing that?
Yeah.
Okay, great. Let's do that. So, that's perfect. So I'm going to ask you to position the camera. I'm going to have you lay flat on that. It looks like a day bed. And no pillows, just out flat. Good. So I'm going to have you take the tips of your fingers, whether you're right or left-handed, whichever one you feel more comfortable with, and start on one side of your abdomen. If you want to start on the right or left, I'm going to ask you just to press down gently, kind of like you're kneading dough. And tell me if you find any point that feels uncomfortable and work your way down your belly towards your pelvis. Anything hurt at all?
No.
Okay. And then why don't you cross over to the other side and make sure you hit all the spots. Good. And anything hurt on that side?
No.
Okay. And can you go to that area that you pointed to before? I think you might have missed that. Great. And does that hurt when you push down and do the kind of the kneading like the dough there?
Little.
Okay, a little. I'm going to ask you to do one more thing. I'm going to have you actually press down with a medium firmness, and then I'm going to have you let go. And can you tell me when you press down versus when you let go, does one hurt more than the other?
When I press down.
When you press down, it hurts a little bit more? Okay. So let's talk about what I think could be going on and how we can use your history and the exam that we just did together to figure out next steps.
Okay, sounds good. Thank you.
Good.
By using simple techniques that guide the patient and gain their assistance, you can successfully complete a thorough abdominal examination. And remember from our consent video, if you or the patient ever feel that the virtual exam is not sufficient, you can bring the patient into the office for a more comprehensive visit.